Hi there, welcome back. In today's video, in this tutorial I'm going to teach you how you can treat abnormal uterine bleeding. So we have drugs here. The first one we have is combined oral contraceptive. So this is the drug in which we use to control any abnormal bleeding from the uterus. Okay, we also have tranexamic acid injection BB 500 milligram per 5 ml. We also have ibuprofen tablets 400 milligram. We also have amoxicillin and clavulanate potassium 1000 milligram. We also have oral tranexamic acid tablet BB 500 milligram. Okay, before I start, let us see now brief overview. What is an abnormal uterine bleeding? An abnormal uterine bleeding is any unusual bleeding that comes from the uterus. So what are the cause of abnormal uterine bleeding? It can be as a result of hormonal imbalances. So conditions that can cause hormonal imbalances include, the first one we have is an anovulation, the second is thyroid disease, the third is polycystic ovarian syndrome, the fifth is obesity or due to stress. Okay, there is also structural abnormalities that can include benign, that is a non-cancerous growth which can appear around the uterus, which include uterine polyps, uterine fibroids, adenomyosis or endometriosis. There are also possible medication which can cause abnormal uterine bleeding, which include blood thinners and aspirin, hormonal replacement therapy, tamoxifen, which is a breast cancer drug, or intrauterine devices, or by using birth control pills. There are also other causes which include kidney disease, liver disease, miscarriage, ectopic pregnancy, or pregnancy. These are the factors which can cause abnormal uterine bleeding. Okay, what are the signs and symptoms of abnormal uterine bleeding? Which include heavy or abnormal bleeding during your menstrual cycle, bleeding between your menstrual period that lasts longer than 7 days, or heavy bleeding that is unusual. That are the signs and symptoms of abnormal uterine bleeding. So how can it be diagnosed? Your doctor will recommend a complete blood count test or hormonal test, a pelvic exam, or ultrasound scan of the uterus. So your doctor will order a number of the possible diagnoses, which include a blood test, which can include complete blood count or hormonal blood test, thyroid function test, or a pelvic exam. Okay, what about the treatment of abnormal uterine bleeding? So the first drug we have is combined oral contraceptive. So this is the drug in which we use any abnormal bleeding from the uterus and related to pregnancy. We also have tranexamic injection, in which we use to treat abnormal uterine bleeding. So second, we have ibuprofen. We use ibuprofen to treat any abnormal bleeding. We also have, if there is any intra-abdominal sepsis, or if the bleeding is as a result of infection, we prescribe amoxicillin and clavulanate potassium 1000 milligram. You can also prescribe tranexamic acid tablet oral BB 500 milligram. So these are the list of drugs in which we use to treat any abnormal uterine bleeding and related to pregnancy. So thank you for watching and have a nice day.